Hi.
Well, good morning.
Good morning, Regina.
How are you?
Great. How are you?
I'm doing well. I've been
Wonderful.
thinking about so many of our talks that we've had, and they're just simply amazing. I'm glad that I didn't leave the thoughts and the conversation here. I was able to have a discussion with my family and some of my friends, and they were like, wow, tell me more, give me more information.
Right.
So what I'm finding is that many people, regardless of what they're doing or in what capacity they're in all of these stages, they want to know more information. I think
Yes.
that they can apply it in any situation.
Yeah, isn't that wonderful? I'm
It
having
is.
the same experience. I left our visit yesterday and I felt so energized about our conversation and talked also with my family
Oh, yeah.
and just it's very refreshing when we can sit down and really take the time to share our thoughts and learn from each other. Even though
Yes.
I've been doing this for a long time now, working as a psychologist,
Sure.
I'm constantly learning, and I just have really enjoyed our conversations.
Absolutely. I always am talking about culture, and I'm always talking about being culturally responsive.
Right.
And when I was able to not just take the information that you shared from your expertise and be able to say, these are some of the steps that we could actually do, and these are some of the challenges, but also, how does this connect personally to you, your situation?
Right.
Because, like, I was talking to a friend of mine, and she says, my mother, I'm really struggling because we have religious beliefs. And so how are we supposed to connect? Because there's some things that we can and can't do.
Right.
And it was really neat to be able to have that discussion with her. And she was nodding her head and agreeing, and she felt really energized, like someone finally hears me.
Gosh, that's profound. Isn't
Oh, I
it?
know. It
That
is
profound.
It really is.
Wow.
So this is great.
Well, I am just so excited to start another conversation
Sure.
today. And just for our listeners out there, I'll remind you, my name is Dr. Sheri Gibson.
And I'm Dr. Regina Lewis.
And we are so excited to bring to you another podcast that has been supported by the Connecticut State Long-Term Care Ombudsman through a CARES Act funding. So really a wonderful opportunity again to expand on these different topics that are really on the hearts and minds of all people, but
Sure.
particularly residents of long-term care communities, the people who provide care to them, and of course their loved ones and family members.
Absolutely. And I believe that it has just heightened itself since the beginning of the pandemic, really looking at COVID and just quickly, we didn't have time to process. We were just going straight into, here it is. Then we have to do social distancing, which we now don't want to call it social distancing.
Right.
What was the term that you said?
Physical distancing.
Physical distancing. So really having that physical distance. And then we had to have masks on. And
Right.
this was just something that we would either see just in a hospital or we would see it in other countries. And so
Absolutely.
all of this was very different. We started getting online and having to do a lot of interaction through the internet. And then we turn around and what happens? We see the news all the time. Now we see it more than ever because we're not distracted with other work.
Sure.
Because we're just right in front of it.
Yeah.
And it has taken us everywhere from isolation to grieving to trauma. Even.
Yes.
Yeah.
And trauma is the focus of our discussion today. Really important to recognize the individual experiences of everybody. And you and I have highlighted this in other podcasts, but we may have experienced the same type of trauma.
Right.
One that resonates for me is the events of 9/11.
Oh, yes. Oh, yes.
I mean, I remember distinctly where I was
Right.
when I was sitting in my car and I heard the radio interruption that this had happened, and then watching the horrific images of the planes into the Twin Towers.
Yes.
And I remember that being so heavy and the fear of
Right.
what could happen.
Right.
And that trauma stays with us, right?
It does, and it makes you wonder because as you're saying it, I thought I knew exactly where I was too. I mean,
Yeah.
I could see the trees, I could see me in the car, I could hear the radio, and
Mhm.
that feeling. And so I kept wanting to ask you, did you ever feel like you could get past that trauma, that traumatic feeling, that emotion that you were experiencing in that moment? And it wasn't just in the moment, it lasted because it kept coming on the news and people were
Right.
talking about it.
Right.
And then it started to feel like, are we safe?
Right.
And here we are. That was, 2011, right?
Yeah.
And now we're in 2021.
Right.
And we're not focusing on that.
Right. Right.
So it's like, okay, so how did that disappear?
Mm-hmm. Absolutely.
But now we're facing other traumas. But what we can do is go back to a time
Right.
when we had trauma,
Right.
and be able to say, what was my process? What is it that I actually did,
Yeah.
or other people have done to get through that,
Right.
that can help us get through the traumatic times of
Yeah.
today?
Exactly.
Mhm.
And that actually happened much further back than, I believe it was 2001.
2001. I'm
Right.
sorry.
Yeah,
You're
no.
right. I don't know why I said 2011. Yes.
But still, when the anniversary of 9/11 happens,
In
it's
20
that,
years.
yeah, it's that reminder and that familiar kind of feeling of unease and fear. And
Absolutely.
it changed everything in what we know about travel and national security, changed all our behavior from that
Absolutely.
moment.
I'm glad you brought that up, because when you talk about that, things changed.
Right.
That became the new normal, and to the point that it's normal. We all expect to have to go through security and take our bags and place them here and take off our shoes. Something that we didn't have to do years prior to that. I
Right.
remember being able to walk on the plane and sit with my mother until it was time
Time
for
to
the
go.
yes, and then walk back off the flight.
Right.
There's no way you could do that today.
No.
But it had become so normal that
Right.
it was no longer the new normal. It was just the way we do things.
That's right.
And so we're now looking at things that are taking place today
Yeah.
that we're calling our new normal, that's going to be just part of our normal way of living and being.
Exactly.
Yeah.
And I think that the current contemporary time with this pandemic begs that question of, okay, how resilient will we be as a people, as a country, and what will post-pandemic life look like
Yes.
for us?
Yes.
What are the things that we've now had to adapt to, and the new ways of living that will be part of our normal life moving forward?
Right, right. And but just using the term post-pandemic kind of gave me a little sense of ease. Like, this too shall pass.
Right.
And I don't mean like it's going to disappear,
Right.
but it's not going to be so, condensed and so
Sure.
concentrated.
Yes.
And we will be able to function within it.
Yes.
And so that is a light. I like hearing that.
Yeah. Again, we've when we talk, it seems that we go to that more optimistic
Sure.
kind of frame, thinking about, yes, this too shall pass.
Right.
Yes, we are resilient people.
Right.
And I think that resiliency piece is such a part of the dialogue around trauma.
Right.
Because there are people who exactly experience the same type of thing, maybe from different degrees from the trauma.
Sure.
For example, your experience and my experience, I was here in Colorado when 9/11 happened,
Yes.
but you're also a veteran.
Right.
And that has a different salience for you.
Absolutely.
To see that kind of terror. Right?
Exactly. So, something that you are just bringing to mind in a cultural aspect is really looking at the layers.
Yeah.
That, it's not just two human beings who have heard about this traumatic time, or then we have to say, okay, yes, we heard them, but our experiences from our past helps us to see it a little bit differently
Right.
and be able to deal with it a little bit differently. So as a war veteran, so now I go back and say, when have I felt like this before?
Mm-hmm.
What is it that I can do about it today? Because obviously I survived, I'm okay, I'm
Right.
here today. So what tools from my toolbox can I pull out and be able to use? Because now what that's doing is it's helping me to bounce back from adversity. That's
Yes.
basically what resiliency is. And
Right.
so that's what we use. And so, in that same situation, you were not in war, you were
Mm-mm.
not a veteran,
Mm-hmm.
but there was something that you did to bounce back.
Right.
Do you remember was it self talk? I mean, what did you do?
Well, I'm a talker.
Yeah,
So I process a lot with my closest, my friends, my family.
sure,
And I
sure.
think it was about coming together with those people to talk through
Oh,
the
yes.
fear, to talk through, what did this mean for us? Also, reading the news, watching the news, reading more about what the government's response was going to be to that
Right,
trauma. I remember thinking, I felt helpless in a lot of ways during that time because what could we do for the people in New York?
right,
And so there's this kind of, um, you know, just feeling impotent in
right.
our ability to do anything,
Absolutely.
and sitting back and just waiting for whatever's going to happen next. So I think for me, it was really talking about it
Right.
and not being alone. Yeah.
Absolutely, absolutely.
Mm-hmm.
I know that in one of our other talks we were talking about being altruistic.
Mm-hmm.
And I during that time I felt like if I have any strength, then how can I use my strength to help someone who isn't as strong?
Right.
And to be able to give, think about what you have to give in these times and what you can offer. It could be a conversation, it could be a listening ear, it could be a gift, it could be anything. And
Yeah.
so just being able to do that,
Right.
I believe really does help. So, Sheri, when we're thinking about trauma,
Mm-hmm.
how does this play out today? I mean, here we've dealt with a lot of things in the past year. We're not even a year in yet. It seems like it's been several years, right?
Right.
But we're almost at a year mark,
Mm-hmm.
and there's a lot of trauma that has
Mm-hmm.
taken place. And
Yes.
so can you talk about some of those challenges,
Yeah,
especially in the
absolutely.
context of our conversation today?
Well, absolutely. As you all know, COVID-19 has affected
Oh,
just millions of people, have now killed nearly 500,000 people just in the United States. And although the vaccine is now here and there's that kind of light at the end of the tunnel for a lot of us, there's still a long haul in front of us. And the stressors related to the pandemic right now have had serious mental health effects on
sure.
many people. And it's quite normal for people to experience the distress related to mass tragedy as we have seen unfold over the past year. And those losses are both real. So, for example, death of a loved one or watching, I remember in the beginning where in long-term care communities, for example, where we saw refrigerator trucks lined up outside of hospitals, outside of long-term care communities where there was no place to put the deceased. And that image has had not only an impact for people who saw it across the country who were not in a hot spot, if you will, but for the people who were on the front lines during that time.
Sure.
And I've heard, people working in long-term care, direct care service providers who say, I was trained as a certified nursing assistant, a CNA, and now I'm having to do the job also of a coroner.
That's
And
right.
the
Yes.
impact that has on an individual in their work. And so the losses are both real in terms of death, but then the losses are also symbolic. The loss that we have experienced of the old normal, the loss of not being able to attend important milestones with our family members, the loss of not being able to hug grandchildren or the grandparents or to hold a parent's hand.
Yes.
The symbolism around missing graduations or July 4th celebrations and all the things that we do as a country and through different cultures throughout our diverse country. Those are symbolic and so those losses are very multifaceted.
Absolutely.
Right. And the response to that is also multifaceted.
Absolutely. And it has taken our nation and every individual to be empathetic and understanding to these different ways of having to mourn, different ways to have to deal with the trauma. Yeah. And so everything that you said, now imagine you're going through that. But layered on top of that, culturally, you're also dealing with other trauma at the exact same time. Yeah. When I start thinking about how it was televised about George Floyd, this was traumatic for every person who watched it. Anyone who's humane and has a soul felt it.
Right.
But as a person like myself, who's African American, who's looking at this man who is calling out to his mother, I am seeing a reflection of my own son, of my own brother, of my own father, because his skin tone is to my skin tone. Right. So there's another layer of connection.
Yes.
When we started seeing those children from Mexico being put in cages.
Right.
Although it was traumatic for me, I can't even begin to understand the layer that goes along with that for those who either was going through it personally or those who are reflected in those visuals. Right. It becomes really, really difficult. I even think about this year, not just in terms of race or ethnicity, but also in regions. People are dying in Texas, freezing to death.
Yes.
Freezing to death.
Right.
So you take a person, say someone's here in Colorado who either has family in Texas or you have somebody who's homeless who hears about this. Now they're thinking about their own situation. It's very scary. Or if you're taking care of a loved one who maybe is a senior, you're worried now, like if the electricity goes out, if we don't have any utilities, what do we do at that point? So these are the layers that we have to look at. It's the intersection. They call it intersectionality when we're talking about diversity and looking at the layers and how do we address them?
That's a very important point to make. And I'm wondering if you could help us and help me understand it. Another layer of that is what it's like to be a white privileged person during a time of such social unrest and injustice. And going back to your experience of watching George Floyd, my experience of watching that too was horrific at a different level. And for me, and I don't know if this is true of a lot of white people, but being the majority, there is this sense of white guilt. And maybe you could expand on that because it's traumatic in another way. I feel the trauma of feeling embarrassed, of feeling guilty, of feeling complicit somehow because of my privileged position. And, one thing that we saw around this trauma of George Floyd and so many before him and after and since him, Breonna Taylor, so many other, But one of the things that we saw were white people came out to the protests during that time to support and to at least show that we are here. But there was also some resistance around that too.
Yes.
From the, where have you been?
Right.
Why weren't you here earlier?
Right.
Can you help us, get a sense, because I want to address that too, and this is a very sensitive topic.
Absolutely.
And I think part of that is that we have to own our privilege, whatever that is.
Absolutely.
Because there's that matrix of privilege.
Right.
How can you shed some light on that?
Absolutely.
Maybe I'm not saying it so eloquently.
No, I think that you were doing a fantastic job here. So some people struggle with the term privilege because it's, in a person's mind, they might say, I'm not privileged. I had to work for everything that I have. And that I understand, and I believe that that's true. However, when you think about privileges, it's when you have unearned access and information that is not given to other groups. I have privileges too. You just in the position that I stand as a person with a PhD, I might have some privileges just as soon as they know that I'm Dr. Regina Lewis, then they might, just come this way, or I can give you this unearned, right? And so at some level, we all have these. And so in white America, we talk about that unearned privilege that you can show up in spaces and places and it just works for you in some situations,
Right.
And so it's like, okay, even if I own that, what am I supposed to do?
Right.
Well, let's go back for a moment. You can Google the images from the march on Washington with Dr. King. And in that march, you're going to see several people with white skin. If you go back, there's a movie being played right now. It's The Underground. It's like the Underground Railroad. Okay. And it was about those who were enslaved, who were making their way to freedom. But it took people with white skin to risk their lives to do that.
Right.
And so now you say, well, I've always been here. I've always tried to help. And so I'm here again, but people don't know me like that. And so then they're now angry because I'm standing alongside you. What am I supposed to do?
Sure.
Well, there's several things. Provide spaces and places. If you have a privilege to open a door, to have a platform, give your platform to a person of color to use their voice. They don't need you to, use your voice for them, because that's that savior complex. It's more or less that you are saying, here's a platform, use your voice. You can amplify your voice and speak. And you know that I'm here in support to also provide resources at the level in which I'm able to do that.
Right.
Another one is when we're dealing, as a white person, dealing with white guilt. A lot of times it becomes emotional. And we see, especially white women, get emotional and cry. African Americans, one of their dimensions is affect. We're very emotional. And so when we are emotional and things are happening, and then we see a person, like a white person, come and they start crying, then we automatically go to their emotion, which has removed what we're going through.
Right.
So something that can be done is, hold back on the emotion, be empathetic, but not emotional.
Right.
Give that space and place for others and listen. I'm here to just listen. I know that I was having conversations with some that are in law enforcement, and we were going back and forth between Black Lives Matters and Blue Lives Matters, and that just became this. And what we ended up doing that was just so magical was listening to each other, getting to the point. Our beliefs and our experiences are very different. But what is the point? And it is about humanizing people because many were being dehumanized.
Yeah.
So we just want to be seen as human, and we want to be included.
Mm-hmm.
We want to have a sense of belonging, regardless of where you sit.
Mm-hmm.
So let's have a conversation about that,
Mm-hmm.
and let's see how we can actually get there.
Right.
So that it was a big deal when we just sat down and listened.
Listen.
Yeah.
That is such a wonderful point. And
Mm-hmm.
thank you for explaining and giving all of us some ideas about how we can be supportive.
Sure.
And how we can use what we bring into every interaction
Right.
to help that further that the voice, you know,
Yes.
letting people speak and being the listeners. And I think that, you know, this is something that we talk about in trauma, and in when we are in any kind of interaction where there's a power imbalance.
Right.
So, for example, even in healthcare, a person, you know, who's a healthcare professional walks into a room with a client or a patient or a resident, and there's automatically a power differential.
Sure.
Because of my role as a provider, I
Mm-hmm.
hold the power in that interaction.
Mm-hmm.
And so one of the things that we can do in those individual interactions, as you said, is we have to stop talking and allow the other person to talk.
Right.
And it's when we stop talking that the power starts to balance.
Absolutely.
Right.
And I also think that in those situations, you have to make a conscious decision whether or not you are going to be an ally
Mm-hmm.
or an advocate.
Mm-hmm.
You know, an ally is going to support you from the back.
Mm-hmm.
You know, what do you need? An advocate is going to put some skin in the game. They're going to make themselves uncomfortable. They're
Right.
going to be a part of that.
Right.
You know, I looked at my ancestry and I found out that the person who had enslaved my great 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 grandmother
Mm-hmm.
ended up marrying her,
Mm-hmm.
and he also opened up his doors as a school to help others to learn to read and write, but he was risking his life to do so.
Right.
There were many people with white skin that risked their lives,
Mm-hmm.
but I can't say that it was all.
Mm-hmm.
And we've got to get to a place where we come together, because a nation divided will fall.
That's right.
And these are the United States.
Mm-hmm.
That's important.
That is so important.
Mhm.
Well said, Regina.
Mhm.
I think the other thing I want to talk about briefly is when we're discussing the concept of trauma and the
Mhm.
experience of trauma of many people, that the Substance Abuse and Mental Health Services Administration has done a lot of work around how do we become trauma-informed citizens.
Yes.
And by being trauma-informed means that we understand that anyone in our interactions, anyone that we interact with, may have a trauma background.
Sure.
And so we don't need to know exactly what that trauma is, but if we understand that the prevalence of trauma, and particularly, you know, right now during this pandemic, we don't even know what the trauma is going to look like because we're still in the crisis.
Yes.
And so we have to wait maybe even a year down the road to see how it's going to all shake out. But if we understand the prevalence of trauma, we recognize that trauma impacts people at the individual level,
Yes.
and that everybody is going to have a unique experience. If we know that and we put that into practice so that we can actively resist the re-traumatization of somebody else.
Yes.
And this is so important, this point, that last one of re-traumatizing. There are things that we do very benignly that can be interpreted as a threat to somebody else.
Yes. Oh, I love that
Yeah.
you said that.
And this is so, I think, such a good point to make within long-term care communities.
Before you keep going, I just want
Yeah.
to say that in culture, we would call that unconscious bias.
Oh, right,
Yeah.
right.
Yeah.
And that the unconscious bias is what re-traumatizes an individual.
Absolutely.
Yeah, by our actions.
Right.
Yeah.
Right. Unconsciously, we don't know that we're doing it.
Right.
So, yeah.
Right. That's wonderful. I love how these two, psychology
Yes.
and the cultural responsiveness,
Yes.
multicultural, that intersectionality
Absolutely.
happens. Right.
That's right.
That's wonderful.
Yes.
In long-term care, there are things that healthcare professionals in their care of residents will do that doesn't feel safe to a resident.
Right.
And particularly around the quarantining, where, a person can't go into a dining room and have communal dining with their peers, are cut off from maybe the traditional faith services that they receive in long-term care, and now that has to be done in different ways. We have to be very mindful of the way that we are interacting and talking with people, and the way that we're being with them that might be traumatizing them and re-traumatizing them. What may feel safe to us, that we're protecting somebody, does not feel safe to that person.
That's right.
I often think about this in situations where an older adult has had traumatic background, and this could have been child abuse that happened early on. And now they are moving into a long-term care facility where they have to share a room, a very tight space, with another person who they don't know. And how unsafe that might feel to that person. And it's unfortunate because people have all kinds of reactions that might come out in anger, irritability, yelling.
Yes.
It could be crying, lots of different behaviors that should indicate to us as care providers or loved ones, family members, that our loved one who is a resident in long-term care is struggling in that situation.
Absolutely.
And so what can we do to resist the re-traumatization of people who have trauma backgrounds?
Absolutely. I do believe that you really need to understand and know the individual. Building those relationships of mutual respect would be very helpful. So you need to know the person. There's a couple things as we start to wrap up here that I want to also say, talking about, the traumas that you're experiencing and listening, I believe, is a really important piece. Something that one of the doctors did, I thought was really fantastic. He was from India, and he videotaped himself getting the COVID shot, and also showing over time how he felt. Oh, my arm is sore. What happened the next time when he got the second shot, so that he could show and model behavior for people.
And that also speaks to the transparency.
Absolutely.
When we tell people what to expect next, what we're going to do as healthcare providers, what we're going to do with that person or in their care, if we are transparent along the way, which I think that example really highlights that beautifully, that's how we build trust in relationships. And when we work with trauma survivors, trust is probably the most critical component. That's the thing that has been violated of the trauma survivor. There's an element of mistrust then that happens. And so the way we build the trust is, one, we listen.
Yes.
We become transparent in our communication, in what to expect. We also become transparent in the mistakes that we make.
Sure.
I'm going to make mistakes.
Absolutely.
And I'm going to flub up and say the wrong thing. But if I can acknowledge it with the person and say, hey, I made a mistake, or come back to it.
Absolutely.
That helps build the trust. And that is such an important key component to healing. And I think that also highlights that healing does happen in the relationship.
Absolutely.
And these are all things that we can do, to build those relationships and give a person who's had trauma a corrective emotional experience.
Sure.
We each have an opportunity to do that.
Well stated. Fantastic. Wow. This was a powerful talk.
It's good. It's good. Well, Regina, thank you so much again.
Absolutely.
Really.
And thank you.
Yeah.
I'm glad that we're able to have these conversations. Make sure that you listen to this podcast and then take it out to your family and friends and use it yourself.
Right.
The conversation doesn't stop here.
No, it doesn't.
So we want to thank you for spending some time with us today.
Thank you so much. And thanks to all of our listeners out there. We really wish we could be in person.
Sure.
Wish we could see all of you, but this has just been wonderful. And we look forward to seeing you again. Thank you.